Hello, is it Katie?
Yes.
Hi, my name is Nisreen. I'm one of the ST5 working in this department. I understand that you are the one who have recently joined our department. Is that right?
Yes.
Yeah. Can you tell me how's everything going so far?
It's going well.
That's great. So I'm here to help you at any time. So feel free if you need any help or you want to ask about anything to come to me and speak, and also to come to anyone in the department. Okay?
Okay, thanks.
No worries. So I believe that you came today to know more about Kiwi vacuum delivery.
Yes.
Okay. So can you tell me why do you want to learn about that?
Well, I haven't seen it before, so I wanted to know how it'll be done.
Okay. So don't worry, Katie. I will tell you everything about it today. Uh, but before that, can I know if you know anything about Kiwi vacuum delivery?
Yes, I do. I know that we apply it when we need to help the mother deliver her baby. So we apply a cup to the baby's head.
Oh, that's brilliant. So you know some information about it. So I'm going today to tell you more details about it. So we are going to speak about the indications, the contraindications, and also I will show you how we do the procedure itself and the anticipated complication as well. I will tell you as well how to do the post-delivery care and how to document and debrief the patient. And do you have anything in particular apart from these items you want to discuss?
No.
Okay, that's good. So by the end of this session, I will give you also some links and some videos to demonstrate Kiwi vacuum delivery. These are very useful links on the RCOG websites and strategy websites. You can go through them, and then also I may advise you to practice on a simulated mannequin if you are free. And at any time ever, if I have a Kiwi vacuum delivery, I will call you to attend after taking consent from the patient. How does it sound?
It sounds great, thanks.
Okay, no worries. So first of all, we speak about the indications of Kiwi vacuum delivery. So we have maternal indications and fetal indications. Okay. So let's speak about the fetal indications when the baby is having distress in the second stage of labor. Okay. And regarding the maternal indications, we have maternal exhaustion when the mother can't push anymore or she feels exhausted, so we need to help her. And in some certain maternal conditions, when we need to shorten the second stage of labor, like if the mother having some heart problems, or if she has like myasthenia gravis and we don't need her to do great effort in the second stage, so we will just shorten it with the use of instrumental delivery. And also if we have a prolonged second stage of labor, um, usually we have certain time limits for the second stage of labor. Do you have any idea about it?
Yes, for the priming gravida, it's 2 hours. For the
Yeah.
multipara, it's 1 hour. And we add an extra hour if she's under epidural.
Excellent, you are a great learner. Okay, so that's all the indications for the Kiwi delivery. And before going ahead, we must know the contraindications for Kiwi vacuum delivery. The first is if we have extreme preterm labor. If the baby is less than 34 weeks, that's absolute contraindication because the baby head is little bit fragile. So if we apply a cup on the head, that may cause like trauma and possibly intracranial hemorrhage to the baby. Also, if we anticipate some bleeding disorders to the baby, like if the patient has a family history of bleeding tendencies, and we anticipate the baby will get this problem, so if we apply a cup, also we put him at risk to have a bleeding. Okay. And also the contraindication is if the baby is having a non-vertex presentation. That means is if the baby is coming with the face presentation, or if it is breech, we can't apply the cup. Okay. um, so I will just tell you about the procedure itself. So first of all, we have some mnemonic just to understand or not to forget any step, including the prerequisites and the steps of the procedure. So we'll start with the letter A. First of all, we need to address the patient. So before we have any procedure done, we need to go to speak to the patient first and tell her about the complications and the possible risks, and address her concerns if she has any special concern or anything like that, and to take her consent for the procedure. Okay?
Okay.
Yeah. So usually we do this instrumental delivery in the room or in theater. So if we are going to do it inside the labor room, we need to take a verbal consent, and if we are going to do it in theater, we need to take a written informed consent. Okay? And then, because we are putting extra thing inside the vagina, we need to ensure that the patient is fully comfortable and having adequate analgesia. So for example, if she's under epidural, I have to confirm that the epidural is working well, and if she's not under epidural, we may need to do some infiltration like pudendal nerve block, or just infiltrate the perineum with a local lignocaine or anything like that. So we need to be sure that the patient is fully comfortable. And we need also to examine the patient abdominally, okay, to see how the head is engaged. So we have to be sure that less than 1/5 of the head is palpable per abdomen, otherwise we can't apply the Kiwi vacuum delivery. Okay? So the letter A includes 3 items. So first of all, address the patient concern. Second is adequate analgesia, and third is abdominal examination. Then the letter B coming the next is to empty the bladder. So B, bladder. So bladder should be empty. Okay, and usually we go and try to empty the bladder. Sometimes it may be difficult due to deeply engaged head, but we have to do at least in and out catheter before applying any instrument. Then the letter C is when the cervix is fully dilated. We have some prerequisites. We can't apply any instrument unless the cervix is fully dilated and the membrane is ruptured. Okay, so we just need to see the head and nothing in front. And then the letter D is to determine the position. Do you know how to determine the position?
Yes.
Okay, so that's great. So you go inside the vagina with 2 fingers, feel the fontanelles, and feel where is the posterior fontanelle, where is the anterior fontanelle, and align them with the sagittal suture, so you will know well if it is occipito anterior, occipito posterior, because there are different applications of the cup if it is anterior or posterior. Okay, and then the letter E is to ensure that all the equipments are ready. So we need the equipments, which is the Kiwi and the equipments for the vaginal delivery itself, because we may need to cut an episiotomy, so we need all the suture bags and the instruments ready for the delivery. Okay, and you can also test the suction of the Kiwi cup on your hand. You can put the cup on your hand and start to do the bumping effect, so that you be sure that it is working well. The letter F stands for flexion point. I will show you soon where is the flexion point on the doll. So if we have the sagittal suture, like if its length equals 9 centimeter, we divided it into 2 parts, like 6 centimeter, like anterior 6 centimeter and posterior 3 centimeter, and the flexion point is the junction between them. So the flexion point lies exactly 3 centimeter in front of the posterior fontanelle, or 6 centimeter posterior to the anterior fontanelle. I will show you the flexion point soon. And this flexion point, we need to apply the cup so that the center of the cup should lie exactly on the flexion point. Okay? Don't worry, I will show it to you now. And the letter G is standing for the gentle traction. So gentle traction, and the traction must be only during contractions. You can't ever pull in between the contractions. So we can apply the cup in between the contractions and become ready and ask the lady to tell us when she feels a contraction. Or if she's under epidural, I will ask the midwife to have a feel in the tummy and tell me when there is a contraction. Then I will start to pull, because it's, like a combined effect from the pull from down below and the push from the mother herself. Okay, so that's the gentle traction. And the letter H stands for hold on, like when we need to abandon the procedure, when we tell this Kiwi vacuum delivery is failed. So if we have pop-ups like 3 times of the cup, and to avoid that, we usually use the two finger technique. So I put the thumb on the cup against the head, and the index finger to support the head, and this is counteract my pulling effect. Okay, and if we have no progress for 20 minutes, or if we had 3 pulls and no delivery happens, so these are the 3 situations when we need to tell no, it is not successful. Okay, the letter I stands for incision, which is our episiotomy. So once the head is proceeding to the perineum and crowning is happening, we need to consider episiotomy. Actually, we don't do episiotomy as a routine, but it's sometimes needed in cases of Kiwi delivery, just to give a room for the head to come, and also to direct, if we are going to develop a perineal tear, to direct the tear away from the back passage muscle. And the letter J stands for jaw. So when we saw the jaw, then we need to release the pressure. So I will show you now where is the button to release the pressure from the cup. Okay, so don't forget to take cord blood sample for any instrumental delivery, and also to anticipate the complications. So the complications can be either the shoulder can stuck in like a condition called shoulder dystocia. Have you ever heard about that?
No.
Okay, so I will arrange another session and I will explain to you more about it in details, because it having different maneuvers to be taught. So I will arrange another session for shoulder dystocia, but bear in your mind that this is one of the common complications in instrumental delivery. And also the one of the complication is the postpartum hemorrhage, because we expect perineal tears, so mainly from trauma. Okay, and what are the complications from this procedure? So again, we divide it into maternal and fetal. So maternal complication is mainly perineal tears, and these tears even can extend to become third or fourth perineal tears. The fetal complication can be we need to tell the patient from the beginning that she may expect some swelling in the baby head, and this is called chignon, and it will go within 24 hours to 48 hours and doesn't have any effect on the baby. But if it is something which is complicated, we may found a Kefal hematoma or subgaleal hemorrhage as well in a serious cases. And if any complication happened, we need to go and speak to the patient. We do debrief, duty of candor and everything. Even if no complication happened, we need to go also and explain to the patient that everything went well, and that's of the good practice we have, because some patients may have some afterthoughts from the labor, making her scared for the next time delivery, and if she feels comfortable this time, that will help her in her coming delivery as well. Don't forget to go and document everything, including the timing. There will be a specified midwife or a specified member of the staff who is documenting the time of the application of the cup, how many pulls you have, how much is the duration you have pulled, and how many contractions. So all of these items should be placed. If any tears, if you have experienced any complication, what about the baby, all and everything should be documented in place. Okay, do you understand what I told so far?
Yes.
Okay, so do you have any questions?
No.
Okay, now we are going to demonstrate whatever we told about the procedure on a mannequin doll. I will show you where is exactly the flexion point and how to put the cup on the center of the flexion point. And after that, I'm going to give you a feedback form. So if you please fill that feedback to me, just for me, for myself, to improve my teaching and to learn more information about my skills of teaching. Is that okay for you?
Yes.
Yeah. So as you can see here, this is the fetal head and this is the sagittal suture. These are the two fontanelles. This is the posterior one and this is the anterior one, and sagittal suture in between. As I told you, we'll divide it into two parts, 3 and 6 centimeters, and the flexion point will lie here exactly. Okay, so let's have the cup. So this is the suction cup, as you can see, and this is the area where we apply to the head. This is the suction tube, and this is the pump where we press and create the suction, and this is the pressure indicator. Okay, so we are going to the green, then to the red, and this is the button to release the pressure. If we press like that, then it will relieve the pressure. Okay, let's apply to the flexion point and see. So like that, and try to keep the groove on line with the sagittal suture. So like that, so this will be the correct application. So usually when we bump to create the suction, in the real life the cup will really stuck to the head, but because this is just a plastic doll, it's very difficult to stuck because no secretions or no tissue to be sucked in the cup. Okay.